Hi, thank you for joining me on this journey doing CBD, the essential guide to CBD from this book, doing myths and facts about CBD. I'm on myth number 9, and this is you need clinically proven doses to get benefits. There is no one recommended dosage of CBD. When used as a prescription pharmaceutical, the dosage tends to be very high, ranging from 5 milligrams per kilogram per day up to 20 milligrams per kilogram per day. That's a typical dose range of Epidiolex for children with epilepsy. So that translates to a large quantity, and it's huge expense for the pharmaceutical version. For serious diseases like Parkinson's, ALS, and chronic debilitating pain, something approaching clinical doses of CBD isolate might be in order, but it may not. But when combined with THC or other cannabis components, the amount of CBD necessary for a therapeutic effect may be significantly less than the dosage recommended for Epidiolex. That's been what my experience has been for all my clients and myself. And the other issue with the pharmaceutical version is that it comes with preservatives and artificial sweeteners. So some people have problems with that. In addition to the huge expense, it was almost $3,000 a month for that pharmaceutical. You can buy a lot of quality CBD for that money. You can buy everything. To assuage everyday aches and pains, take the edge off anxiety, or get a better night's rest, you can likely benefit from considerably lower doses. Manufacturers generally recommend between 10 and 50 milligrams of CBD per day, depending on your body weight and severity of symptoms. That's interesting because my husband is he's a foot taller than me, easily 100 pounds more than me, and he needs less than I need. And, I'm older, we're both in our 50s, but I'm postmenopause, have all that fun stuff going on, have some autoimmune issues going on. So he just needs a little bit every day, and I need a lot more than he does, and he's easily 100 pounds more than me. So it's not necessarily weight-based. It's important to keep in mind that CBD isolates require higher doses to be effective than whole plant CBD-rich oil extracts. Reports from medical cannabis clinicians and patients suggest that a synergistic combination of CBD, THC, and other cannabis components can be effective at low doses, sometimes as little as 2.5 milligrams of CBD combined with a similar amount of THC. But many people need a stronger dose to notice difference in their health. Remember that low and high doses can produce opposite effects. So an excessive amount of CBD could actually be less effective therapeutically in some cases than a moderate dose. So it really, with CBD, it's always best to start out with a low dose for a few days. I usually recommend doing 3 days at a lower dose, twice a day. And then if you're noticing or not noticing something, you can increase it from there and, go up a little bit. You want to start low and slow with CBD. It doesn't necessarily take a lot, so there's no sense wasting the product, and you want to get the maximum benefit. And whole plant isn't actually as beneficial. You want the whole flower. That's where everything is in, not the whole plant. When something says the whole plant, there's not a lot of value or CBD in the stems, so it's really in the flower. So that's what you want. You want whole flower. Full spectrum would be more of the full flower, and then broad spectrum will be taking out the THC, and then isolate is really going to narrow down on just the CBD. So to get the full entourage effect, as this myth was addressing, you want to get as much of the flower in you as possible. But if you get drug tested, you want to go with a broad spectrum or isolate. But if you use the isolate, you probably will need a higher quantity than you would need with a broad or full spectrum. I hope that helps. If you need help getting a recommendation for CBD, I can happily do that for you. Remember, Consistency is important, and the quality of the CBD is most important. Thanks for listening.